Everybody, I am Naufal. Welcome to my channel. Today we are going to discuss regarding Glasgow coma scale. Glasgow coma scale. So what is meant by Glasgow coma scale? It is the technique, it is the assessment technique used to identify the level of consciousness of a person. The technique used to identify the level of consciousness of a person. It is used to identify whether a person is in coma stage or not. So most of the students are thinking it is very difficult regarding Glasgow coma scale, but it is very easy. Only 3 things we are checking here. In Glasgow coma scale, only 3 responses we are checking. That is eye opening, verbal response and motor response. Regarding the eye opening of the patient, how your patient is opening and closing the eye. Regarding the verbal response, while you are talking, how your patient is responding, that is verbal response. And regarding motor response means body movement of your patient. Now the maximum score of the Glasgow coma scale is 15. Maximum score of the Glasgow coma scale is 15. So we will check eye opening first. Regarding the eye opening, so if you are a nurse, you are assigned in neuro ICU and you are going to check the Glasgow coma scale of your patient. So first you will check the eye opening response. In the eye opening response, first one is spontaneous eye opening. That means your patient, like a normal person, he is opening and closing the eye. That means spontaneous eye response is there. Like a normal person, your patient is opening and closing the eye. That is spontaneous eye opening is there. So you can give 4 mark. Spontaneous eye opening is there, you can give 4 mark. We are checking the eye opening response of the patient. Spontaneous eye opening response is there, means you can give 4 mark. If your patient is having spontaneous eye response, give 4 mark and move to check the next response. No need to check the remaining response. If your patient is not having the spontaneous eye opening response, you have to check the response to sound. Response to sound in the eye opening. Second step is response to sound. Spontaneous eye opening is not there means. If spontaneous eye opening is there means you can move to check the next response, that is verbal response. If spontaneous eye opening is not there, you can check the response to sound. That means you can call the patient. You can call the patient by calling his name. By calling his name. So while you are calling the name of the patient, if the patient is opening the eye, you can give 3 mark. If you are calling also, your patient is not responding, you can check response to pain. You can give a pain stimuli. That means give a pinch to the patient. That time if the patient is opening the eye means you can give 2 mark, that is response to pain. Give a pain stimuli. So while giving the pain stimuli, if your patient is opening the eye means you can give 2 mark. Spontaneous eye opening is not there, he is not responding to the sound also, he is not responding to the pain also means no response to pain stimuli also here. After giving the pain stimuli also, patient is not opening the eye, you can give 1 mark. If your patient is having spontaneous eye opening, give 4 mark, move to the next step. Spontaneous eye opening is not there, response to sound is there, give 3 mark and check the next step response. Okay, only coming under eye opening, any one response will be present. If the response is present, move to the next step. No need to check everything. Okay, now regarding the verbal response. That means while you are talking, how your patient is responding. So first one is in the verbal response, oriented. That means you are asking to your patient, where are you now? So the patient is telling, I am in the hospital. So orientation is there for the patient. You are asking to your patient, where are you now? So your patient is responding, I am in the hospital. that means oriented. You can give 5 mark in verbal response. If your patient is not oriented, your patient is confused, that means the same question you asked, the patient is telling I am in the hospital, then he is telling I am in my house or I am in my office. He is confused. So you can give 4 mark here, 4 mark. Now, inappropriate words. You are talking to your patient is responding but not in a proper word. Something he is telling but you can't understand what he is responding. That means inappropriate words. You can give 3 mark. Okay. Now, incomprehensible sound. Your patient is not oriented, is not confused, he is not talking also but making some sound only. He is not talking. Incomprehensible sound. He is making some sound only, not talking. So you can give 2 mark. Now, no response at all. While you are talking, your patient is not at all responding. You can give 1 mark. Now, you have to check the next response. Here also, if the patient is oriented, you can move to the next step, that is motor response. You can check. If the patient is not oriented only, you have to check regarding whether your patient is confused or inappropriate word or incomprehensible sound or no response. Now regarding the motor response. First one is obeys command. Obeys command. So motor response, we are checking the movement, body movement of the patient. So obeys command. Here you are asking to the patient, show me your hand, or raise your hand, or raise your leg. So that time the patient is obeying your command. He is showing the hand or he is raising the hand, that means obeying command. So you can give 6 mark if your patient is obeying the command. If the patient is not obeying the command, you can give a pain response. You can give a pain stimuli, that means you can give a pinch in the hand or in the leg. So localizes pain, that means identifying the pain area. Your patient is identifying the pain area, where the pain is, in the leg or in the hand or in any part of the body. The patient is identifying the pain area, that is localizes pain. If the patient is identifying the pain area in the motor response, you can give 5 mark. Then your patient can't identify the pain area but withdrawal to pain. Patient can't identify the pain area but withdrawal to the pain stimuli. That means the patient is withdrawing the hand or the leg, but patient don't know where the pain stimuli is there. He knows somewhere pain is there and he is withdrawing. He is withdrawing the leg or he is withdrawing the hand, but he don't know where the pain area is. So you can give 4 mark. While giving the pain, while giving the pain stimuli, abnormal flexion is occurring. The patient is maintaining a abnormal flexion. That is also called decorticate posture. Decorticate posture. Like this the patient is maintaining the position. Like this the patient will hold the hand. While giving the pain stimuli, your patient is holding the hand like this. That means decorticate posture, that is abnormal flexion. You can give 3 mark. You can give 3 mark. Now to the pain stimuli, while giving the pain, your patient abnormal extension is showing. That means 2 mark, decerebrate posture. Abnormal extension while giving the pain, if your patient is holding the hand like this, in this manner. If your patient is holding the hand in this manner, means that is abnormal extension. 2 mark you can give. No response to pain stimuli. After giving the pain also, the patient is not identifying the pain area, not withdrawing to pain, and he is not maintaining any abnormal flexion or extension. No response, you can give 1 mark. So here in the Glasgow coma scale, spontaneous response is there. 4 mark you have given. Now you are checking the verbal response. Patient is oriented. So you are giving 5 mark. Now your patient is obeying the command. Now you see 4 plus 5, 9 plus 6. The maximum score is 15. Maximum score is 15. And the minimum score, that is no response, we are giving 1 mark. Minimum score will be 3 mark. Now the patient's score, Glasgow coma score is less than 8 means the patient is in coma stage. That's all regarding Glasgow coma scale. We will meet soon with another video. Till that time, thank you and goodbye.